Thanks again, Dr. J.B. Bittner, for talking to OnSurge. Tell us about robotics and hernia repair.
So robotics and hernia repair is sort of a hot button topic. It creates some polarization between those who do it and those who feel that they don't want to do it.
And those who think it's crazy.
Yeah, some people think it might be crazy, and other people swear by it. So what's important with ventral hernia repair in robotics, and for me, the way I've begun to use the robot for ventral hernia repair is not to mimic a standard laparoscopic hernia repair, but by trying to show value in the robot. And in order to do that, what I've actually attempted to do, as has been done at other sites around the country, is to offer a complex abdominal wall reconstruction, essentially an open operation, but using the robot technology. So creating posterior transversus abdominis releases and implanting mesh in the anterior abdominal wall in the preperitoneal space and closing the defect, essentially doing an open operation, but with the robot, saves several days in hospital length of stay, at least in my early experience. So we're trying to translate that robot to some kind of a value because we know it costs more money up front. Others use the robot for simple laparoscopic ventral hernia repairs because they feel in their hands it may result in a better hernia repair or allow them to better close the defect primarily. And then others feel that a laparoscopic repair with primary closure of the defect is more than sufficient, allows them to do it in much less time, and saves them money. So it really is a hot button topic. And actually in March there is a robotics symposium looking specifically at hernia repair and the role of robotics in hernia repairs of the ventral abdominal wall and inguinal spaces that's going to be held in New York City. And so it's going to put a lot of these thinkers together and sort of argue about the value, the pros and the cons of robotics and hernia repair. So it ought to be interesting.
Yeah, indeed. So describe technically where you find the advantage of having those little wrists in there.
Well, for me personally, especially on some types of robotic repairs, it's ergonomically quite nice. So my shoulders aren't so sore at the end of a long day. And
good for you, then.
Yeah, and there's some good ergonomic data to support that. But for me personally, I can do everything with the robot. I can also do laparoscopically, except for the significant separation of components, the posterior separation of components. So for me, it's an enabling technology that allows me to do an open operation, transversus abdominis release with robotic technology, and try to save patient hospital length of stay and post-op morbidity associated with a wound. So that's where I potentially see some value in the robot, and allows me to do something that I might not be otherwise able to do laparoscopically.
Okay. So you said open. I might have misunderstood.
Yeah. So normally a transversus abdominis release or a posterior separation of components is done via an open midline incision, right, or some open incision. And usually they have anywhere from a 4 to 5 or 6 or 7 day hospital length of stay postoperatively. And what we've done in our early experience is to do that same operation, but through 6, 5 to 8 millimeter trocar incisions placed laterally on the abdominal wall.
Okay.
Completely separate those posterior components, implant the mesh, close the defect, and then close the posterior rectus sheath behind it and the peritoneum, in order to perform exactly the same operation we would do open.
Gotcha.
But through a minimally invasive approach.
Gotcha. Okay. Thanks a lot.
We've found that it's saved about at least 2 days of hospital length of stay in our very early experience with it, compared to open.
Okay. Very good. Thanks. Last words on robotics.
I think it's a polarizing thing, but I think it's something that those who are herniologists should at least be aware of and know is here. Whether it's here to stay is going to be dependent on whether we show value for the technology.
And that data is being collected?
That data is also being collected and can also be entered in the American Hernia Society Quality Collaborative.
Very good. Thanks a lot, Dr. J.B. Bittner.
Thank you.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.